So I feel very happy and proud to introduce my best friend today, Dr. Chandrasekhar Khot, uh, currently gazetted officer in railways, and in a recently concluded NEET PG. He has secured All India rank of 78. Congratulations, Dr. Chandrasekhar, and welcome to this special section of White Army. Officer, can I call you as Chandru like before?
Yeah, you can. Sure.
Thank you so much. Thank you so much.
Yeah. Thanks a lot, Kishan, thanks a lot, Kishan, for having me on your channel, and it's indeed a great pleasure. And I must congratulate you also for the great work you are doing with the White Army channel. So congratulations to you also.
Thank you. Thank you so much. People like you keep us motivated and keep on inspiring us to do more and better. Anyway, today's session is basically, there are so many juniors out there who, if they can't clear in one attempt, they feel so upset and they feel they feel low, and they also feel that it's not possible for them, and many such feelings. I just wanted to give you as the best example. See, even 6 years with 6 years of continuous study, we know how difficult it is to get a rank in a NEET PG examination. In spite that, in your case, you didn't study medical PG entrance exam even during the MBBS or even after that also. You had such a long gap of 6 years. Almost you had lost all the touch with medical sciences. Even then, you could, with a minimum of 6 months of preparation or so, you could achieve that, like you are into the toppers list now. So we just wanted to know your success story and your experiences, what all the practicals, obstacles you faced and all. And I just wanted to, definitely Chandru, when I heard your news, I felt, whoa, my God, is it really possible this way? I really felt, whoa. I just want to, my friends out there also feel the same whoa by your, from your own words. So once again, I welcome you and thank you for being with us today to motivate thousands of medicos out there. First, let's start with from the beginning. Okay, let's let's go story-wise. Okay.
So basically,
Chandru, can you please tell about your MBBS time? How was your MBBS days? And I know you were more into the UPSC preparation. So how you got oriented to UPSC, and even you had this UPSC idea before joining MBBS or after joining MBBS? So can you please tell about this?
So while doing MBBS only, I had a thought of getting into civil services, and during MBBS, I was not preparing actively, but in internship I started preparing for that IAS examination. But the one thing is that while I was doing the course, I never neglected the medical subject. I read everything and I attended postings properly. And there is the one thing I would like to advise for all the future aspirants: while you are studying something, give your 100% and give justice to whatever course you are studying, because that's what maybe that has helped me to crack this exam 5 years after getting out of touch with the subjects. Because since during MBBS, even though I didn't prepare for NEET PG, I prepared well for the normal university exams and whatever that whatever competency that is expected of becoming a doctor. So that I think helped me. So whoever, if they have other thoughts also, so never neglect your medical subjects and do them properly. During internship also, I attended everything properly. So during internship also, you attend your postings. So that will help you to become a good MBBS doctor. So whatever you do post that, still you should be having spent 5.5 years of your life, that should be a productive and that should be some meaningful. So that's what I want to advise. And basically why I enter, so if somebody is have a thought of entering into civil services, so why I thought of entering into civil services is basically in Indian health scenario, what happens is all the policy making and implementation is done by the bureaucracy. So actually the doctors don't have a say in it. So in that way, I thought more doctors should enter into bureaucracy, more doctors should enter into civil services, so that the policy making can have a perspective that is there from the doctor's point of view. So that's what is needed. So I still believe a lot of young people should enter into civil services. In our batch only some 2 people have entered, So even during COVID times, it has been proven that those IAS officers who have medical background have performed exceptionally well. So in that way, if somebody has a thought like that, I will suggest them to go ahead with the civil services preparation. But they must remember it's a very risky game, because unlike this NEET PG and other medical exams or science-based exams are more of like objective exams, and they don't have that much uncertainty. They do have a factor of luck and uncertainty, but they're minimal. But in civil services examination, it is more of a humanities subjects are there, and lot of subjective things come into picture. So that makes the exam very uncertain. So lot of luck, lot of other factors play your role. So your success may not be guaranteed even after you put your complete hard work. So that you must keep in your mind if somebody is entering into UPSC preparation. But yet, if you get successful, it's always worth of taking that risk. So I would suggest them to take risk. And regarding so I think I might be inspirational for the people who got long gap post year MBBS to prepare into NEET, because a lot of people, they go to rural service, and because of family reasons or because of many personal reasons, not everyone will be able to give 100% in their first attempt post MBBS. So for such people, what happens is they get out of touch with the subjects, and they get into that negative vicious cycle, and they never be able to perform well in the exam. So for them, what I want to advise is, even though you get out of touch, so it looks difficult in the beginning. For example, I was completely engrossed in the world of history, economics, polity, things like that for around 4-5 years. So then after my fourth attempt in this thing, though I missed narrowly, so I thought I should move on, and I should I thought I have a I should make my life in medicine, because that's the God chosen path for me. Though I wish to become an IAS officer, it's a God chosen path for me. Then I dedicated completely for the NEET preparation. After that, with the work I was studying, and at the end I took a leave for around 2 months. Then the exam got postponed twice, so that added a lot of uncertainties. And again, in second wave of COVID, I lost my father, so that also that made everything into chaos. So still, what I believed is, instead of getting into that cycle of remorse and keep on, so we should focus on what is important. So then after then I focused on my exam only for the last 2 months. And though it was very difficult, I didn't think about result. I just wanted to get on with the exam, and finally, I couldn't myself believe the result. I thought after giving the exam, I thought I may get a rank below 1,000, but top 100 I was not expecting. But maybe I think it's a God's gift for me.
Chandru, you are preparing for UPSC, and after that, now you are, like you said, you narrowly missed 2-3 times, and after that, you tried combined medical services examination, and you were successful in that. Can you please give some glimpses of that combined medical service examination for our members?
So any of you don't want to, many people are not that much interested in clinically pursuing the medical career. If they are so, for such people, combined medical services is a very good option. And for also people, for example, I took it as a backup option. So my main aim was to crack the civil services exam. So anybody who is preparing for civil services exam or doing something else, they can keep it as a very good option, because it's more relatively easier to relatively easier to crack. The exam level of difficulty is same as NEET, but the relatively competition won't be that much. So anybody who has little bit have an interest in administrative part and want to they don't want to pursue their specialization and all, it's a very good choice. And it's like a 2-step based examination. If the first step will be similar to NEET, there will be 2 papers, and post that there will be interview, and combined that people will be allotted to, there are different health services. The railways is one of the health services. There are multiple services like CGHS and then Ordnance Factory Health Service. So such options are there. So it's beyond if somebody don't want to pursue their post graduation courses, they can enter into combined medical services. And if they are not interested in cracking it on their own, there are also opportunities for going into sponsored category seats and all. So that's becoming now a attractive option, and whoever interested, they can pursue that thing.
So after that, you're while working only simultaneously, like last March or so, you started preparing for. You suddenly thought you should your destiny. You are chosen something, but your destiny is somewhere else. Finally, the destiny prevails. So you had to change your path somehow. Okay, fortunately or unfortunately, we don't know. So, but you are working when you started your preparations simultaneously. You are working and then preparing for the NEET as well. So how was it possible to manage both simultaneously?
So initially I was though I was working initially, so I used to get around 5 to 6 hours free time. So during that I used to put in study. And nowadays the advantage of the modern world is earlier everyone used to depend only on the offline classes. But now due to app-based platforms and all, there is even this White Army and many other platforms now have come up. So there is nothing called you need to be in a metro city to get a coaching and all. So now it is I think there is a more of democratization of this preparation, because earlier what I used to see is all the toppers used to be from the all big colleges in the metro cities like BMC, like all Mumbai colleges and all. But now what has happened is that knowledge and whatever that even strategy wise, everything has penetrated into even every cities. Even from people from private colleges are now cracking the exam with top ranks. So this earlier it used to be limited to only prestigious colleges. So I think anybody, in even while working, even in rural areas, they have access to coaching, they have access to all the materials. Now everything is available in digital format. So in that way, I started initially with working only. I started preparing, because initially you won't need that much time to be put into preparation. So only in the fag end, in the last 3-4 months, it's very crucial, because it's more of you have to put in at least 2 revisions. So I took a leave for the fag end revision. So even if you read sincerely for 5 to 6 hours for the initial 6 months of your preparation, I think it does make a difference. So one can pursue, one can do a job and study if they are like financially, if they had to do job. So then that is very much possible.
Chandra, why I ask question, because as you know, now this 1 year of rural service or the bond is made compulsory. So almost all the students have to go through this compulsory rural service. So they'll be working somewhere in district hospitals or so. But they'll be highly ambitious to do crack this NEET examination, the first attempt. So I just wanted to give them a good hope through you that it is possible. Okay, if you make up your mind and if you believe in yourself and put in some extra hours of time for studies, you can still succeed in your examination even while working. That's what I wanted to say through you. You proved it. You proved it. Like in railways and all, you have to manage the OPDs, you have to manage the emergencies, and that administrative part also will be there, and some field camps will be there. Along with that, you put in some extra hard work and you study it well. And like you said, even when you're sitting in the like in your office also, if you're free for a few minutes or some half an hour, you can make use of your mobile phones or gadgets to learn there itself or something. You will not waste time.
That's what they can easily solve. That's what nowadays. That's what I told now.
Spend your time.
So even though will be working, there will be some. Even though will be working, there will be some, like in between we'll get a gap. For example, sometimes, for example, even if you are working in a casualty, there won't be cases coming for certain time. So you will always get a free time in between. So you can make use of those app-based platforms to solve questions. Nowadays, QBanks are there. Earlier, when people used to carry these big books and keep them, and so that was very hectic, and it also looks like a person is reading while while he is working like that. But now you just have to have a mobile in your hand, and so instead of seeing Facebook or Instagram, you just have to open those platforms, and if you solve just QBanks and all. So for example, nowadays very nice, like all platforms have a very nice QBanks. So if you solve some Q bank on one topic, you will get an overall picture of it. So in that way, you can make best use of time during the working hours. And post working hours also, they will get a nice good time, so that they can use. And one thing is, people should not regret about the time that is getting wasted. Sometimes what happens is, if they waste some time, they keep on regretting that I am wasting time and all. So don't put a strict target. Just read whatever possible, and when it comes, whatever possible, and try to finish your target. And if you are not finishing targets, you do some smart work, like instead of seeing video or something, just read the notes or something like that. You have to do and finish of the topic.
One of the mottos of the White Army is study mania in social media. Okay. Just showed that even we can study even in social media, just like you said. Facebook or Instagram can be used even for not just entertainment, but even for study purpose also. In our leisure time, we can use in that way also. Leisurely, we can study. So you started in last March 2020 for your NEET examination. So what was your strategy? So I really feel you should have a lot of courage, Chandru, because after 6 years of gap, you have lost all the touch, almost all entire touch with the medical field, and suddenly you decide to come back for that medical field after such a long gap. You should have a lot of courage and confidence in you. Yeah, I agree with you. Your personality is made for an officer, so you will have that confident nature. And see, even while now talking also, I never feel it's a waste of time or waste of years, just like you said. That whatever 4 years you spent for UPSC, 4 or 5 years, that's worth it, because now we have become the most resourceful person, I should say. Definitely. You are that knowledge will never go wasted. That will never go in vain. Some or the other way, in some or the other time, it will definitely come to your rescue or for your help. So you are the most resourceful person, because as a doctor, I know only about medical fields, but you, even though you are a doctor, now you know everything in detail about the sociology, history, or geography. You ask anything, you know everything about it. So that's you should be feeling lot of you should be having lot of confidence and courage in you now. So what was your mindset and your strategy for the NEET preparation, Chandru, in the beginning?
So basically what you said, we should not have a fear to try something which we want to try, because failures are always like a possibility. Because if you don't try something, if you believe, you will always have a regret. There is no shy in trying and then failing. So after I thought I should give this much, and then I have to move on. Nothing like that. That was my mindset. And once I started NEET preparation, yes, it becomes really very difficult to initially. So there is always the fear of starting is always there in every aspect of it. Every aspect, the first, that inertia, whatever we call, that will always be there. Because when we start seeing any videos regarding NEET preparation or any notes or something, we will not get hold of it. But what we have to do is initially, this is like advice for people who have lost touch with the subject, because initially it will be difficult, but you have to put in that 1 month initial preparation, just whether you understand or you partially understand or whatever.
Again, it's just like going back to first year Mbbs. Everything looks Latin and Greek.
So if you have courage to begin, then you will automatically find a path to easily move on. Then later the journey becomes very smooth, and you start getting confidence. Things getting interconnected. Then you start getting interest. So first 1 or 2 months will be very challenging. So that's what I will advise. So first, even though you understand what, put in hard work and have a great faith in yourself, and that if you get into those 1 or 2 months, then you will automatically, that there won't be that much problem, because we have already studied these things. Though it whatever gap you have long back you have studied, it will all come back to you, and it will all help you. Like as I have studied, if you have studied well in Mbbs and if you have attended postings and all, it would definitely help. So that's what I will advise.
But whatever it is, Chandru, whatever you say, it's incredible achievement, I should say, because you're not just got some average rank or some say mediocre rank. You are in top 100, man. Out of 2 lakh people, you managed to get 78th rank just with some 6 7 months of preparation. That too was also not a proper preparation. You had to face lot of struggle in between. Okay, we'll not mention it again and again, but still, it's a big shock. Okay, losing any of our parents is not a small thing. Okay, yeah, you might have felt once.
Hardly like
How
like
I just
in the
want to
month
know.
of
I just want to know, Chandru, how you could, because life is not about how hard you hit. Okay, life is all
yeah.
about how you go on by keep on getting hit, getting hit. Got my point?
That's what it's
Okay,
like.
you can.
That dialogue from Rocky movie has always inspired me. Like
Yeah,
it's not about how hard you can hit; it's about how hard you can get hit and then keep moving forward. So
keeping
that's
motivated.
like
So
whether it is whatever, like whether it is career-wise or personal problems
loss.
or anything. Like we will
Chandru,
definitely
you
have
had
a
one of the
difficulties in
biggest
life.
shocker. You had one
Yeah,
of the biggest shocker in life. So how you could
yeah.
get along or get through
That's
that
what in the
situation?
May. That's what exam was almost postponed to September this year. Then in the suddenly because exam was in April, then suddenly the second wave hit hard, and during the same time in the May, my father got infected with COVID. So I almost spent 1.5 months in hospital. Then post that to manage all family responsibilities, almost 2 months, I totally it went waste. So post that, I during that time I never thought about NEET only. Then post I lost my father. After that, I thought like after some 15 days of I took time to get over with all the emotions and whatever those negative like. But what I felt was if I keep crying, so there is no point, because if whatever I have done for 1 year, like whatever preparation that will go waste, and I won't do justice for the whatever dreams I and my father had. So if I
Absolutely.
cry, that won't change the fact that has happened. So only if I read and then uh, but that time I was not thinking about result. I just wanted to get a rank below 10,000. That's it, because I can go anywhere. Just I want to finish like 10 or 5,000. So that only thing is, after then I got over, then I started studying back. It was definitely difficult because when you are sitting in a closed room, the constant thoughts, the thoughts of all memories keep haunting you. So still, I try to move, not getting distracted by it. I just focus. I didn't think about how many hours I was studying. Only thing I wanted to do, I want to finish all the things in a shorter way. And then I studied properly for 2 months. And so I used to read some inspiring stories or whatever quotes. Then I kept myself motivated and kept myself deviated from my personal feelings. And then I just wrote the exam without any great zeal of getting a great rank or something like that.
Expectation. Yeah,
So
that's again
sometimes
one
if
of
we
the
don't,
reason for a success.
sometimes if you don't think
There was
much
no
about
pressure.
the,
There was no expectation.
when you don't have expectation, when you don't think that much about result, then there is higher chances that we can give
Yeah,
the best of ourselves.
performance.
So maybe that has worked in my case. So that's
Chandru,
what.
what was your
Yes.
timetable was like? What was your timetable, day-to-day timetable? Like how
So
you used to keep
definitely,
the targets? No, no. For each
yeah.
subject, how you used to keep some targets or some timetable you should have made? No, what was your strategy?
Yeah. Like initially, like things used to take a lot of time for me while I was working, and when I started full-time preparation, major I divided into major subjects used to take like 1 week, and minor subjects used to take like 3 days. So what I used to do is just I just had a mind of finishing the things like having at least 2 to 3 revisions. So I focused on that. If things time was falling, so definitely I could not put a lot of hours like the freshers used to do, because my energy levels were very low. So I could only study at the max 8 hours per day. So if I used to see the interview of toppers and all, they said 12 hours and all. So I had to put those the same thing into those 8 hours. So what I used to do is I just uh, uh, at least I used to just read main things and then skip the things which are important, which are not important. So in that way, I manage the my timetable. So I don't usually used to put strict targets, because sometimes that demotivates us if we don't finish the important topics.
Chandru, you are studying in your now where you're in Nashik, no? You are posted in
Yeah,
Nashik.
I'm
You are
posted in
studying there.
Nashik.
So
Yeah.
yeah, you're studying alone. So how
Mm.
you used to know what's your competency level, how competitive you are for the examination, where you stand among others, because you like lot of competition added.
Mm.
Okay, so
Mm. Mm.
how we used to
That's what nowadays, as I told,
make out
now
all
all
those
the
things?
grant tests, all the grant tests are available online. So as I said, all the online. So that's what I told. The present, like recent, this is a new revolution since last 2 3 years. These all app-based platforms have definitely, not made, any, like wherever you are, you still can. For example, I used to give grant tests every week or at least once in a 2 weeks. So that used to show my level of preparation. Then I used to, make changes in my preparation. Then that helped me in keep on improving and studying better.
But do you get that seriousness while studying alone? Because we used to see, you remember, we all used to sit
Yeah,
together in our BMC library and study. Then we
yeah,
used to keep motivating ourselves when we look at others studying seriously. Then we also get kind of seriousness and motivation to study. When you sit alone and study, do you really get such kind of seriousness or
That's no, definitely it was very difficult because if we keep comparing, because all my batchmates have already finished the post graduation, so that kind of comparisons and all keep coming in my mind. But the only thing is we should not compare too much with other people. So what I used to do is that's what I always kept my expectations low. Only my aim was to study as much as possible. So
perfect?
for example, I made some friends from the online with whom I used to nowadays, like even calls are free, no, like not like this
Yes.
thing. So I used to discuss on the call. So in that way, even though I was studying alone, I kept in touch with some of my juniors and other people. So that helped me, but definitely it was very difficult. But that is not the case with me alone. It is even case with all the freshers also,
All
because
of
of
them.
COVID, all the libraries are closed. So this is the problem specific to this year, because everybody was facing that problem due to
Yeah.
exam getting postponed twice, and due to COVID, all libraries, reading rooms are closed. So everybody was in the same boat. So so that's what did.
Chandru,
Yeah.
what was your last 2 months of action like for your revision? What you
Mhm.
really, how you revised?
So basically, I focused on the previous year paper. See, the
Okay.
NEET PG into the syllabus for NEET PG is very vast.
Okay.
So what I suggest is we should do previous year papers, because most of the times you cannot finish all the topics. So if you see the
Yes.
previous year topics, the same topics keep on repeating. At least they will change the within that same topic they keep on asking. So what I suggest is during last minute preparation, people should focus on previous year papers, and along with that, there are very high yield subjects like second year subjects. I would say I would rate them very high: pathology, pharmacology, microbiology. And if one is thorough with these subjects, they have high weightage also. Indirectly they will
This
you
time
can
there
score
were
very high.
a lot of questions from forensic. I heard.
Yeah, that is definitely there. That
Is
all
it?
short subjects is a separate. Yeah, definitely those
No,
like
this time
forensic.
particularly.
Yeah, around 10 questions were there from forensic, and all very easy to crack. So like that, all short subjects is a different category. First thing is this second year subjects, there are high weightage, high yielding, and indirectly they will help us to solve all the even clinical subject questions also. Along with that, I would suggest focusing on PSM and OBG. These subjects like PSM and these subjects, if one focuses, they can get, questions will be easily doable, because strike rate will be very high, because if you study these subjects properly, you can get most of the questions correct. So after that, like for example, subjects like medicine, pediatrics, they are very vast. Even though if you study many times, you won't be sure of cracking all the questions. So that's why people should not,
Not finish.
break their head too much into them. They have to finish the whatever all the important topics. Then don't worry too much about them. Instead, focus on these high yield subjects. And along with that, the short subjects are also very important. They will, they are very, like as you said, forensic medicine and this radiology, psychiatry, anesthesia. So they will have a
Ophthalmology.
very,
Yes.
very few topics from there. Things keep on getting repeated. So people should prioritize subjects, and in that also they have to prioritize the topic. So that will help one to revise, have a overall picture within a short span of time.
Chandru, I had a doubt. Okay.
Yeah.
Students always crib over the change of pattern in examination.
Yeah.
I really wonder, does it really matter? One who studied the subjects properly, does the pattern of the examination, does it really matter for you, a student? Because see, this time also what they did at the last moment, there will be 300 questions. No, this time they made it 200 questions. Sometimes there will be earlier there used to be simple fact-based questions. Now they say they made it like case scenarios and all. So do you have different strategies for different type of pattern of examination, or you read the same thing? It all depends on the like application of your knowledge on the day of your examination. I just wanted to know whether the pattern of examination matters.
No, definitely pattern of examination matters, and I would agree with your second thought, because means the whatever that preparation remains the same. Only thing, the approach should change, because now they are changing. For example, as you said earlier, there were 300 questions to be solved in the same time. Now they are giving 200 questions, and they are making the questions little bit lengthy. So one has to have an application-based mindset. And nowadays they are stopped asking all those unnecessary fact-based questions. What they are focusing on simple basics. They are focusing on basics, and at the same time they are focusing on clinical application. So that is making like somebody who like they are that these are all positive changes that are there. For example, earlier they used to simply ask what is the selective media for Shigella, then they will used to give 4 options. So that is the, for example, that is. So in that time, they used to give 300 questions. Now what they do is they will give some case study suggesting that Shigella. They don't give the organism. Then they will ask what is the selective media. So in that way, what they have made is they have interconnected things. Earlier, when the 300 questions were there was a subject-wise division of questions also. Now what they did is they have removed all that and they have integrated everything. So in one question. And nowadays, actually, the questions are like unnecessarily. That is, that fear is being instilled. The questions are easy if one has understood the concept. They are giving like multiple 3-4 clues in the big question, and then they are asking what is the probable diagnosis. So that if one has a right mindset and right approach, that pattern won't matter that much, I think. But only thing is one's approach and strategy has to be a little bit different from the earlier one. And they are not like they are giving enough time to solve the questions. One can think properly. And nowadays, what is happening is even though they ask a very simple question, people are overthinking and answering. So instead, like they should think like things are very simple and basic, and they should have a more with common sense and with elimination. One can solve a lot of questions. That's there.
Chandru, 2 questions. What was the best thing you feel you did during your preparation? Second thing, what you should not have done during your preparation?
I think the best thing I did during preparation is I think I just focused on important topics. I didn't, think much about finishing everything. And then one more thing is I kept on giving grand tests and kept on solving questions by the along with reading the notes. That is the one thing. And something I shouldn't have done is I used to read very slowly because my
there is nothing because you got the best possible rank now.
That's what. Yeah, that is hindsight. It is there. There will be some factor of luck also, but because of my slow reading, I couldn't revise as much as I planned. So that is the other some negative thing.
So last 1 week before examination, what was your mindset? How confident you
were?
Oh,
last year, that's what I want to give that. There is a concept.
How many times you revised? By the way.
Because of postponement, I could revise. The plan was only for around 2 revisions. Because of postponement, I got more time and I could revise around 3 to 4 times. And one more thing I used to tell, there's a concept of 20th book. For example, that is very helpful. That helped me a lot. 20th book means there are 19 subjects in the NEET. So what we should do is we have to make, for example, that could be stick notes also. For example, simple no facts. Any any, for example, biochemistry diseases and that enzyme defect or whatever microbiology, this selective, like those things, we have to make stick notes and such things which are oftenly repeated, high yield points. Such things we have to make in a one book from all subjects, whatever it is. For example, surgery, some, for example, all scoring systems, what it is for. Such things we keep on, they keep on repeating. We keep on forgetting. For example, simple GCS score is there. So if we don't read that in the first 1 week before the exam, we will definitely make a mistake because we don't have that much time to remember it. So such things we have to write in a separate 20th book. That's for 20th book. And last 1 week, I think we should focus more on that thing, like revising these, easily forgettable, often repeated topics. And along with that, previous year papers one should do in the last 1 week. That is the strategy.
What we used to do is, Chandru, I still remember
Yeah.
my preparation time. I had a tab. We used to read from the book only. We didn't had all this app based or other things.
Yeah.
We used to read from all 18, 19 books we had. We used to read that. And I used to take the photographs of important, the charts or boxes, whatever is given. And during our free time, when we get during the lunch break, if you get some 10 minutes time, we used to just go through those important boxes or charts, high yield, like you said, instead of notes.
That is same thing.
Save time, you can do that also.
Yeah, that's the same strategy in that. Now you can take a screenshot of important points in a QBank or whatever, then keep on revising. That's what people do.
Yeah. So, what was your exam day? How you feel about your exam day? What was your mindset? How was your presence of mind in front of the computer? And how do you rate your performance on that day?
Exam day, I think one should remain calm before the exam. They should have at least around 5 to 6 hours of sleep. So that definitely I was very much tensed because it's a very high stake exam happening over 3.5 hours. So that tension will always be there, but still one should not try to minimize the tension. And during the exam day, one should remain calm. If you remain calm, then you can think freely. You can gather all the, for example, whatever you you read over the year, that will come into your mind only if you have a calm mind. So I kept calm, and then since now there is a time management is easier because of lesser number of questions. So I could easily, once I gave the exam, definitely I felt that I performed very well. So I thought I will get some better rank, something within 1,000.
Okay.
So I think I was satisfied with my performance on that day.
What was your score?
I scored 675 out of 800.
Great. That's great. So what was your, before the exam, what was the plan before the exam, and does it remain same now or it changed after the result?
No, the plan, I didn't make a plan because I had nothing to compare myself. So my plan was I had only shortlisted medicine, or I wanted to do medicine or radiology. So depending upon rank, I wanted to decide. So I think most probably I'm thinking of doing post graduation in radiology. Hope let's see what happens.
See, social figure, like what is a personality like you, who always likes to mingle with the people and who always very empathize for the people. So how you imagine yourself to be like always in front of the computer inside the AC room? Can you imagine yourself?
Yeah. No, that is definitely there. Still I'm in that process of thinking and making a decision. So I think your inputs will definitely help me, that's definitely a downside of it. So let me think over it.
No, I don't intend to change your plans.
Yeah.
Because radiology is definitely a good branch, because you see, it's end branch, you can finish it off in 3 years. Secondly, you can practice anywhere you want. Okay, wherever you are, in the rural practice or city, wherever you want, you can practice. And relatively cool branch, and so that you can pursue your hobbies also. Other thing, what you can give some time for your family and or for your hobbies, something always good only. I agree with you. But since you are from the civils background, I thought that way. Okay, so you may have
Yeah,
different plans.
yeah,
We
yeah.
will come to know after 3 years. Okay,
Yeah,
3 years of
yeah,
this
yeah.
thing. So
Yeah,
Chandru,
definitely.
yeah, Chandru, you were a good inspiration for all of us during your study time. Also, you are very sincere guy. Used to study very seriously, and you always you are a gentleman, I should say, because you always maintained your cool and composure. Even now, you remain the same. Now you look little more diplomatic.
No, no.
Okay, so what's your you are definitely you are a big inspiration for all of us. Okay, I feel really good. Okay,
No, no, no.
really good about it.
That's
So please,
that's nice of
what's your
you. Mm,
what's your
mm.
uh, tips or for your guidance, words of some guidance for your juniors there?
Yeah, the words of guidance. What I want to say is we can't plan, in long term. See, sometimes things cannot be planned in a very long term. We have to just think of the immediate future and keep doing what we think. For example, it is said we cannot connect the dots looking forward. We can only connect them looking backward. So in that way, I think one should not make very rigid plans. For example, people come into MBBS first day, they will tell, I will become a neurosurgeon, I will become a cardiothoracic surgeon, like that. So after getting into, people will understand what is the. So one should not make a very long term plans, because we don't know how the things will turn out. But short term, over the next 3 to 5 years, like that, one should have a plan. One should work on it. One should focus one's all energy, effort, and different things. And then, for example, so for freshers, what I suggest is, post MBBS, they should not waste time in anything, because that energy they will not get.
Yeah,
Uh,
yeah,
so they will not get again, and it is also not that easy to correct things after a very gap. So one should not deviate their focus post MBBS. That 1 year they have to dedicate to NEET preparation and get over with it. So that's what is my advice. Yeah.
what do you attribute your success to?
Yeah, I attribute the success to this is like perseverance and resilience. That's what I call.
Okay,
Definitely, at
okay,
the end, that hard work is always there, but one should have that character of not giving up, and
yeah,
one should keep on working on one's goals, not lose hope, not compare with others, and not criticize others, and one should focus on improving oneself. Like we should strive to become a better person next day, rather than comparing with other people. And one more advice I give to people is, if you are in a difficult situation, so
mhm,
one important strategy that helps is, we should compare ourselves with the people who are in more difficult situations. So that will give a sense of, if you compare with
yeah,
somebody
exactly,
who is
exactly.
in a better position, we always see that our life is horrible, like that. So instead, we should
Absolutely,
compare, because becoming an MBBS doctor itself is a biggest privilege, because not many people get to opportunity to get education also. In that way, we have to compare ourselves with the people who are in difficult situations. Then we have to derive strength and then move forward. So in that way, that comparison thing can be used in a better way. That's what I tell.
this is called positive attitude or optimistic
Yeah, yeah,
approach, Chandru. Okay,
yeah,
looking
yeah, yeah,
positivity in
yeah,
everything. Even if I fail
yeah, yeah,
today, I
yeah,
look at the positive side of it. Yeah, I my
yeah,
my
yeah, yeah.
to be what happened, my own incident.
Hmm.
Just 6 months before the my MS examination, my
Hmm.
internal examiner told me,
Hmm.
"I'll do
Hmm.
surgical strike on you, Kishan." That was the time that there was surgical strike. So he told me, "Kishan, I'll do surgical strike on you.
Uh,
I'll fail you. That means I'll fail you in examination." I
hmm.
directly, I don't know whether right or not. I told in
Hmm.
front of him only, to his face, I told, "Thank you, sir.
Hmm.
If you fail, I'll be
Hmm.
very much thankful to you, because I'll get
Hmm.
1 year of extra time to study my
Hmm.
lovely surgery."
Yeah, yeah, yeah.
Even now, if you
That,
ask me, what if you have done, you were given one redo chance, I tell
hmm.
I'll go to first year MBBS and study
Hmm.
anatomy, physiology at again.
Yeah, yeah,
Okay, so
yeah. Yeah,
that's all in everything. Life is all about how you look at it.
yeah, yeah, yeah.
If you look with a positive intent or a positive
Attitude.
approach, whatever you
Hmm.
believe, na, that will become, for sure,
Yeah, yeah, yeah.
for sure.
Yeah, yeah.
I
That's.
always tell
Hmm.
my students, like what you just said, hard work. The formula for success is hard work plus self confidence equal to sure success.
Yeah.
Sure success, not just because, not just the hard work. That's why I was stressing on that point. Confidence also required. Many people do a lot of hard work, but they don't believe in themselves. They don't have that self confidence. That's why the results is not in their favor. When there's a good combination of hard work along with the confidence, nobody can stop you from succeeding. Chandru, so it's a time for interaction with our members now. So if any one of us having any clarifications or any doubts, you can directly ask Dr. Chandru. You can unmute yourself and ask him directly. Yeah, good question. I also wanted to ask the same thing. Sai Prasad is asking you, why did you choose NEET PG over combined medical services? You are in a good position. You are a coveted officer there, okay, which you always wanted to be. So why did you choose NEET PG over that?
Good question. So it's a good question. Combined medical service is definitely a prestigious thing, and but the problem with it is we have to work in different parts of the country. So though that's the thing. So if somebody is interested to move on different areas, then they can continue in combined medical services. One more negative thing about CMS is the administrative. You will have a lot of administrative work. Your clinical work will be little bit limited. For example, even though you are so that is one of the negative things. So if you want to stay close to your native place, and if you want to focus more on the core clinical aspects, see somebody wants, for example, some pediatrician is there, he is there in the CMS. So the pediatrics part will be 50%. The other administrative part he has to perform, which is not at all connected to pediatrics part. So if somebody likes that, then they can go ahead with CMS. So if somebody don't like and they want to focus on core clinical aspects, they want to do research and they want to focus only on the clinical part and not at all interested in administrative. Administrative part means there are a lot of related to all medical administration, hospital administration, like such duties will be there in CMS. So it all depends upon whether you are interested in it or not.
And Mr. Rahul is asking you, is there any kind of bond in CMS? Now, what's the route for you? Route out for you?
No, the only thing is if you get selected through UPSC, it is compulsory to serve for 1 year. So, for example, if you get into railways, they will give a training to you for around 3.5 months. So you have to serve 1 year. That is compulsory. If you want to leave before 1 year, then you have to pay whatever the cost of training and whatever salary you have received. That the post 1 year you can resign anytime. And in the CMS, there's the option of going for the sponsored seats. For example, as these aspirants have seen this AIMS notification, JIPMER, PGI notification and all, there is something called sponsored seats. They are basically meant for the central government doctors only. So if you want to go after 2 years of service in CMS, one can go for those seats, which are easily available. They are like, there won't be that much competition there. Even in railways, there are a lot of big hospitals in Mumbai, Chennai. There DNB seats are there. One can easily go for those. They are like in service seats. So if one goes for those seats, post that PG, they have to do bond for 8 years.
Okay.
For example, if I taken the seat through sponsored category, post PG, I have to serve in railways only for 8 years. So I was not interested in that. So I don't want to I don't want to have a long-term career in that. So I thought of getting a rank on my own and then studied. So if one is okay with that, they can have a relaxed life and just given it, even if they get around 30,000-40,000 rank, also they will easily get a very good seat.
So that 1 year is including 3.5 months of training or excluding that?
Yeah, including that 3.5 months of training. The training will be given in IR Vadodara. So including that training,
you're done for more than 1.5 years now, so you can resign now.
And, I have done more than 2 years also now.
2 years now, yeah.
There is no point.
So if you're breaking in the middle after your bond, that 8 years time, Is there what is
Huh.
the is it possible to break the bond, or what is the
Yeah,
way
it's
out?
possible to break the bond. That amount will be very high because they will pay the
Okay,
same salary during post graduation. During post
okay,
graduation, the salary is paid from the department only. So whatever salary, it will amount to around 40, 50 lakh like that, because they will pay salary for around 3 years, even though we are working in some medical college. So that and all amount will get into around 42. So it is not easy to break. So one takes those seriously, and one is so one is they can take no problem. And nowadays,
so
they're definitely a very good option looking at the current scenario in the outside world. So like I suggest aspirants, if they're interested to stay away from their home places and all, it's definitely a very attractive option.
how the postings will be? Do we get postings of our choice or preference, or they'll put on their own randomly postings wherever
No,
there's vacancy?
they are put on the basis of vacancy only, because the problem with CMS is one more thing. The South India has a lot of medical colleges, and most of the doctors are from South India only. So what happens is, whether it's in railways or CGHS, initially, like all the South Indian whatever places are there, they are have very less vacancies. So so that is the negative point of it. So people from North India can easily get the place of their place, but people from South India have a difficulty in getting their native place initially. But after serving for around 2 years, they can get transferred and all, no problem.
Do you get to go abroad with this CMS, like WHO under? Can you work for WHO and all?
Such opportunities are there, but there like in CGHS and all such more than railways, there is that CGHS such opportunities are there, because they will be managing all these health programs. For example, all the health programs come under this CGHS. So under if somebody is interested in that, they can choose for CGHS under the CMS.
Uh, I have not tried CMS, but after my post graduation, if I want to join railways or
Hmm.
in
Hmm.
such institutes, is
Hmm.
it possible directly through
Yeah,
interview?
it's definitely directly possible. That's what post MBBS, the posts are called ADMO. Post PG, they are called DMO. So one who has done super, for example, there are in Chennai, that Perambur, there is a southern railway central hospital is there. That's a very good cardiac
Very good.
center. Like first bypass surgery happened in that.
Correct.
In such
First
centers,
pediatric
definitely
transplant
one
also
can
there.
join directly. But the only thing is, you should be ready to have a fixed salary. You should not be doing private practice. If one is ready and they want to serve in a government setup, they want to serve, they are not interested in corporate culture and all. It's definitely a lot of like it's definitely a very good option, because in Mumbai also there are good hospitals like Jagjeevan Ram, which are very super specialty departments.
Okay.
So one can directly join there.
Mr. ABCD wants to talk to you. You can, Mr.
Yeah, yeah,
ABCD,
yeah,
you can
yeah,
unmute yourself, and if you want to
yeah, yeah,
congratulate Chandru, or if you have any questions, you can directly ask him.
yeah,
Any
yeah.
one of you, you can unmute yourself and you can ask directly. No need to type. Yes, ABCD, we can't hear you. No, we can't hear you, ABCD.
Yeah, yeah. Unmute yourself and speak.
No, no, he's unmuted. But
Uh,
okay, any others? Others have any query? Please feel free to ask any kind of questions
Hi,
directly.
hi, sir. This is Sai Prasad.
Okay.
yeah, yeah.
Congratulations, sir. Uh, I
Thanks a
want to
lot.
ask,
Thanks a lot.
I'm a bit interested in UPSC CMS exams, sir. Like, what
Uh,
about the duty hours and all? I just wanted to know, sir.
so duty hours, that's what it based on which one you select. If you select CGHS cadre, no, then the duty will be very much fixed hours. There won't be any night duty such things. So they are very like, I don't know exact timings, but like 8 to 2 like that. They will have a very fixed diary around 6 hours like that. After that, nobody will bother you. That is the case with CGHS. But in railways, what happens is Railways has big hospitals also, little bit smaller hospitals also, and there are some emergency duties also. So relatively, railways timings depend upon the place you are posted. If you are posted in a bigger central hospital and all, definitely your workload will be high compared to any other government hospital. If you are posted in a smaller places, there are places where they're relatively not that hectic. So it all depends upon your posting. That is the case with railways.
Chandra, how is the clinical exposure there? Do you really get to see all kind of patients, and you treat yourself, or you just do the referral, like a referral center?
That's what it also depends upon the center where you are posted. As I said, if one is posted in there are something called central hospitals. Central hospitals means they are in a bigger places like Mumbai, Chennai, Delhi. So if one is posted there, they will have definitely have a very good clinical exposure. They don't refer that much. But in a smaller places, it becomes very difficult to have everything in house. So there is a lot of referral. The clinical exposure will be less in a there is something called divisional hospitals, which are at a little bit smaller places. So such places, clinical exposure won't be there that much. So there is more of this future. There is more of referral to tied up the corporate hospital will be tied up to the this thing. So now the trend is slowly that exposure is getting decreased and more of referrals are happening.
Okay. So any other questions, Mr. Rahul?
And one more thing I want to say is if one is from medical branches, then they will have a good exposure. But one is from surgical branches, then exposure is relatively less because for surgeries, all the even patients prefer getting referred. So that is the downside of joining after doing surgical branches. One can join easily after doing medical branches.
So, Mr.
Conclude with one of the quote by one of my famous personality, Martin Luther King Jr. He said that if you can't fly, run. If you can't run, then walk. If you can't walk, then crawl. So by all means, keep moving forward. That's whatever happens in your life, you keep moving forward, keep focusing on your goals. Then if you have, start from where you are, start with what you have, you can achieve and you will do it. So all the best for all the people who have, I hope this session has been, source of inspiration for people who are in difficult situations. I think I have made a little bit justice.
No, not just those who are in difficult situations, Chandru. Even for the freshers or anyone preparing for the NEET for that matter. Such people get more motivated because a person like Dr. Chandru, after 6 years, he is also an average student, not a very extraordinary student or okay. So average student after 6 years of gap. So if he could achieve this with a single attempt with 6-7 months of preparation, why can't we? We have read for 6 years continuously and sincerely during our MBBS. So we can definitely get as simple as that, the logic. So the freshers or those who are doing internship or rural service should be getting much more motivated than those who are like having gap. Okay, definitely. Your source of real inspiration for all those who are appearing for any PG entrance examination. You have set high standards, Chandru. Keep motivating us like this, and we, on behalf of all the members of White Army, we wish you all the success in life. Okay, soon you become the best radiologist and take much more classes for us in this platform. Okay, from your knowledge, please try to help us. Because you are most, as I already mentioned, you are the most resourceful person now. You are the most resourceful person. Okay, so use your knowledge and experience for the benefit of others and society at large. Let the maximum students get benefited by you, also the patients. Thank you once again. Thank you so much for your time and valuable inputs and insights. Keep continue to motivate us, inspire us, and be the best doctor. Thank you so much. Thank you so much.
Thanks a lot, Kishan, for having me and giving me an opportunity to share my experience. And I wish all the best for the White Army.